Welcome. Thanks for being here. We have a great guest this week, Sue, and she's been struggling a couple of years now with various pains in her back, but then there was also a knee issue. And so she had her meniscus repaired, and we're going to get into that and help her. That was how many months ago?
Like 3 months ago.
Okay,
surgery.
So it's not fresh, which is good. And so we're going to get into some function helping recover that after the surgery. But before we get all the way into that, let me introduce myself. I'm Kara Lindell. I'm the founder of the Bridging Institute. And what we do is help you with pain or balance, coordination, by looking at how all the little tiny micro movements are flowing and transitioning in your body. And we pair that up with what's happened to you and what's going on. And then we have a process of resetting how your muscles are coordinating with each other, and then your pain usually goes away. So we will start with Sue with looking at how she's moving. We already know kind of the issue of what's happened with the surgery, and that's kind of the goal for today, but I want to see like how is it actually affecting her, and is that matching up with what she's experiencing? And then we'll get into seeing what we can put back together for you.
All right.
You've been doing your therapy, right?
Yes, I have been doing physical therapy. Yep.
Okay. And when is it bothering you the most?
It bothers me the most. My knee, prior to the surgery, I couldn't walk more than a mile without having shooting pain up and down my leg and into my back. But after the surgery, it really only bothers me when I start to do exercise, like if I start to do squats or if I start to do some of the things. The first couple times it feels incredibly stiff. But then after that, since the surgery, it seems to be doing better. But I did compensate a lot for a year or two on the right leg, which then I had to kind of work on building up strength in both of those to eliminate that.
And then earlier you'd mentioned that when the knee bothers you the most when you're standing.
If I stand still, like if I have a standing desk, and if I'm on it, I like to stand instead of sit all day. So if I stand and I'm on a call, after about an hour, my legs just stiffen up dramatically if I'm not moving or getting any blood flow going.
Okay, so hopefully we'll get some insights on that and hopefully fix it too. So to start with, we're going to have you stand and just see how your balance reactions are doing. So I'm just lightly holding on each shoulder and moving from side to side. And okay, this is a very subtle thing that I'm not sure is visible, but she easily goes to the right. And then when I get her back to center and try to just very slightly move to the left, you don't go. So if that's the knee or if that's the back, don't know. But I'm trying to turn you, and that was actually hard. Your body had to figure out what was going on, and then finally like, oh, okay, I've got it. And then going to the left, it's not happening. You're finally sensing like, oh, I must need to turn the other way, and I'm just holding really lightly at her shoulder, trying to pivot and not moving. Let's see about front and back. So you're moving differently through the feet on the right and the left. Like the left really isn't moving that much.
Okay.
So it's like you should just rock through, and it's not. So when you had the surgery, what was after? Did you have a boot? What was a wrap? What they
I had
do?
a wrap for about a week, just to make, really, it was to protect the incision.
Okay.
Other than that, wrapping came off after about a week.
But nothing to immobilize it?
Nothing to immobilize it.
That's good. Sit. Let's just see, make sure that all of what we found is not related to anything in your core. Now see, you go left and right very easily. You turn very easily. Can you feel the difference? Yeah, so that leg, assumably the leg, but your back would come into play here too. Lay down and put head over here so that we have a good angle for you guys. And I just want to check some real basic things with legs and just see how different they are from each other. So I'm holding at the right, and it easily lifts. Left, not at all. You can feel the difference on how heavy.
Right.
So her leg literally is not that heavy. It's just the connectivity of it is not helping, so she can't access the core for help. Does it turn? That one's not so great. It's a little bit of motion, but this one's none, especially below the knee. And Sue had showed me earlier that the incisions for the surgery were, if this is her kneecap, they're like right underneath. And I'm just going to pick up, I want to see how easily does it bend. And I'm supporting a little bit, but that's really fluent and easy. And if anything like bothers your back or bothers, let me know.
Okay.
Okay, wow, I'm trying to support and lift, and yes, I'm sure I can make it, but that's not what I'm trying to do. I want to see what's just easily available. So that is not. When you were recovering, was your leg mostly straight or was it bent a little?
It was elevated at the beginning, and then when I sleep, I always bend it.
Okay. So
yeah,
here's what we're
mostly
gonna
bent, I would say.
Okay, so we're gonna prop, but just a little bit, and let's see. I want a lot of support for the knee, so I'm putting this on an angle, and you know what? I'm gonna change this around because I don't want so much dropping with your foot. So, trying to get the right support. Sometimes the question isn't what we're gonna work on, it's how. So I'm gonna put that, and then this one for your foot. There we go. And does that seem comfortable?
Yep, I'm fine.
Okay, so I want to look at below her knee and above her knee, and do they kind of feel like they match up? And right now it feels like they're twisted from each other, and it's like if you were trying to put blocks together, that they need to be shifted around so that they click into place. But I want to be super light and gentle with this and not try to really force it in there. So I'm going to use a couple of our little peanut balls. And I'm going to support on both sides of her knee. And yes, you can see that. And does that support feel like it's in a nice place? Or differently, if I angle it a little bit so it's more at the incision, is that better? Or does it matter?
That feels better a little bit, yeah.
Okay, so I'm trying to go around her kneecap, but then kind of angle in where the actual incision points were. And I'm just holding, and what I feel happening in the middle of that is sort of like a little bit of a melting away. I don't know if you can feel anything. You might feel it relax.
I feel it relax, yeah.
Yeah. So when they put scopes in, even though they're little, you don't know what gets rearranged in the process there. So it's below the knee is actually rotating from left to right, so kind of back to center. And it's funny, it might have been off like just a couple of millimeters, but every millimeter counts. There, so now everything starts to move. Wow.
Yeah, much better.
And so now I'm just below her knee, really more where the incision spots are. So it does seem like it's lined up. I just want to get some more playful movement here. And then because where the surgery was, that's the top of the two bones, the tibia and the fibula, where they interface at the knee itself. And I want to get more movement connecting through there down to the foot. Often, if you watch any of our other videos with the foot or the knee, we're trying to connect the foot to the knee. I think now we're connecting the knee to the foot. There. So it's very interesting. So in the space right below her knee, it feels like there's a little wiggle. We like the term wiggly jiggly. Sometimes you think that's bad. It's actually kind of nice because that means all the muscles, tiny or large, are starting to move with each other. And then all the connective tissue and the fascia and just all the good stuff that lives in that space. But it's just trying to get that nice wiggly jiggly through that whole area so there's some uniformity to it, because again, we don't know exactly what they did with the surgery, but it disrupted it. And it just needs to wiggle again. And do you feel your foot moving around?
I do.
Yeah, so I think we're connecting the knee down to the foot. That's kind of fun to see. There. And now it moves very easily with with a fair amount of control. I'm just going to cascade the same wiggly jiggly all the way down. And then we're going to look at how does the ankle and the knee coordinate together with stepping, flexing, and then how they straighten out. And then we'll have to look at some turning motions too. And then we'll spiff up the right leg too. Because it's got...
Right. Don't ignore your right leg.
There. Oh, so now, okay, this is the wiggly jiggly that most women would hate to admit, but you feel your thigh?
Yes.
Yeah, that was not really happening before so much. And yay. Actually, now I'm seeing it up in the middle. So feel in the middle of you in your core?
Oh, yeah.
Yeah. So when we say movement flows and transitions, this is the flow. It's like, again, with the physics of movement, you want it to be continuous, but you want it to dissipate. So I'm wiggling a little bit more vigorously, and you see more of that up through her body, but it does taper out. It doesn't move her head, which is good. There. Yay. Okay, now it's just, okay, now it isolated. So your hip is moving really well, so that movement is isolating at the hip. It's not going up into your core. So we need both, depending on the angle. Okay. That was easy for me to lift. Mm-hmm. And now it turns. Does that put any stress at your knee?
No, not at all.
Okay. I think it's still missing one transition that would be nice. And I'm going to switch this around to test it. So if I push up from your foot, does your knee angle out like you're going to sit? And that is a hard no. Okay, so just so you at home can see what we're trying to do, I'm going to hope this one works. And so same idea, I push up, boom. So it's actually the angle that everything needs to go for a squat. Okay. So this one, while we're here, we'll just give this one some quick little wiggles. Yeah, and the hip turn, yay. And then make sure that flexing the knee bends flexing the ankle bends the knee and the quads fire up. Yeah, that looks good. How you ride bikes a lot?
Yes,
How
I do.
This has taken you out of the bike riding, hasn't it?
No, actually, it hasn't been too bad. Right before the surgery, I wasn't doing any riding,
there.
but since then, it seems to do okay.
I think, there we go. So it's interesting. The tibia, the inside bone, it was had forgotten how to turn, or maybe it was a little stuck because of the scarring.
Yeah.
So yeah, but that's turning now and bending. Okay, but for you with the standing, I'm as interested in the straightening out, and that actually feels pretty good. So let's see about bending the ankle. Okay, as you said, there was a lot of compensating that had gone on. So I want movement at the ankle to connect to below the knee and then the quads. And it's kind of having a hard time figuring out where to go. So back to a little peanut, just to kind of help provide, I'm not sure if I'm doing a dotted line of here you go, guys, or if it's just a little waking up, but somewhere in there. There we go. Did you feel that change?
I felt it, yeah.
Yeah, it's almost like if you have a straw that you're trying to push something through and it's stuck in the middle and then it just cleared and the shake went through.
Exactly.
There we go. Oh, and then her quads fire up. Yay. Yeah, that actually feels really good. It's moving very easily, very bouncy.
Yep.
One of the important jobs of our legs is to absorb force when we are moving or standing. Okay, let's see if these guys match. I'm going to lift one. Wow, that's a far cry from where we started.
From where we were, yeah.
This one actually feels a touch heavy. So we're going to just give this one a little bit more of a freshen up. Here. Your hip was a little rusty. Let's try this one. Yeah, this one is like super nice.
Yeah.
All right. So then we're going to put both of them together. And I'm going to lift. And okay, this is a test for your left knee. I'm going to move your ankle. Your knee should bend. It did.
Yep.
And okay, it's got to bend up like you're doing a squat. There you go. Okay, low back actually is moving very nicely. And anything on the left not feel okay?
No, it feels great.
Okay, so then what I want you to do is push out. Okay, so the strength is kind of missing.
Yeah.
Okay, so here's what we're going to do for that. I think this may be the first time I'm showing this on video, so those of you who've seen some, you might want to stop and pay attention. Her strength is not so great because the muscles from the front of the knee and the back of the thigh, the hamstrings, they have been disrupted from working together too. So I'm going to hold the hamstrings. It's a little tricky for me. Kind of the points of the surgery, and then I'm also holding the hamstring. So I may have mentioned this before, but it's always a good refresher. The hamstring ends on the front, on the tibia and the fibula, below the knee. So it makes some sense that was a little disrupted.
Yep.
Okay, so I'm kind of reminding these guys they need to work together. So just really slowly push out. Good. We're going to do that a couple more times. Do that again. There we go. And one more. Good. All right, now let's try that with some strength and push. Good. And do 2 more times. Good. Sometimes it needs practice, just like a little timeout. If you have the coach for soccer or baseball, you come off to the side and do a little individual practicing. All right, let's try both of them. So I'm going to bend. Okay, push out. Okay, I'm resisting.
Okay.
Does the strength seem equal?
It's probably still a little bit more on the right, but
Okay, so we'll try again.
but better.
Okay, I'm going to start from here. Push here. That was better. Okay, there's another part that I pay attention to, and it's timing. Is when I tell her to push, do both legs push at the same time? They do, which is good. Okay, so push one more time. That was equal.
Okay.
So we'll do it one more time, and I'm going to add a little bit more resistance. Okay, I got to get ready. Okay, push. Okay, I just saw your core activate.
Yes.
So, yay, they're both working.
Yay.
All right, there may be one other piece to this, and it's how your leg kicks behind you. So either we visit that another day, or maybe it'll end up working. So,
Yes.
Okay, I'm going to hold knee. I'm going to roll you toward me. Very nice. And then we're going to go around to the other side. Check the same thing. Make sure she's centered. Yeah, actually, it's very nice. Sit up. Okay, everything sitting was fine.
Yes.
So go ahead and stand. So just how the weight distributes onto your foot, you should feel like you're more centered, like equal weight distribution.
Yeah, definitely.
Okay, so let's see how you're moving.
Okay.
So again, just really light. So that's more centered. I'm going to actually hold more down at the hip because I want to know more what's going on really directly in the leg. That's actually pretty nice because now that you're going through it a few times, it's very smooth. And then turning. Okay, that's actually really nice. There's an ease, but there's also a spring back.
Okay.
So you want that spring back. That's your athletic. Your muscles pull and then they let go.
Okay.
And then forward and back. You feel how you're going through both feet now?
Yeah.
Yeah. Before, your right foot was pulling up off the ground and your left foot didn't do anything.
Didn't do anything, right.
Yeah, so very nice. Okay, guys, give Sue a thumbs up. Hit that like button. You can sit. We'll just go through a recap. So Sue had meniscus surgery, and even though she's been doing her PT and all the exercises, and it's really getting back to normal, there were some key transitions that were still not quite happening. Just how the area, literally the whole area below her knee where the incision was, just didn't have this wiggly feel to it. So all the little tendon muscle interactions, they could do their basic jobs, but the advanced ones were off the table. So when we got those to work together, then we could pair that back up with her ankle function, but then also with her hamstring function, because that same area below the knee is where the hamstrings end. So if some of you have issues after knee surgery, those are two key things that we consistently find with people. It affects your balance, your ease of movement, and your strength. So if you're interested in being a guest, hit me up. If you're interested in a session, we are located north of Chicago in Northbrook, and you can schedule online on our website. And we also do virtual calls, but you'll need somebody to help you out on your end. Hit subscribe so that you get more advance notice when we have more interesting cases like this. And of course, if you're a professional and you would like to learn more how to do this yourself, we do offer classes, and those upcoming dates are posted on our website. Thank you for being here. Thank you for being here.
Thank you. I feel great.
Yay.